Hello, I am Dr. Bishash. I am doctor of this clinic. I confirm that you are Mr. Adam, 40 years.
Yes.
So, Mr. Adam, how do you feel now?
Doctor, I came to my GB with uh, whitish discoloration of my tongue, like oral thrush. He did some investigation, and unfortunately, I had the HIV, and he offered me treatment, which is fine for me.
Okay. And did he discuss anything, any other issue with you?
I don't have issue. I will start my treatment as soon as possible. But doctor, something I want to tell you, I don't want anybody to know about my condition.
Okay. I absolutely respect your decision, but is there something that I can tell you so that you can reconsider your decision?
Doctor, it is my disease, it's my life. Well, and I don't want anyone to know it. Is there any problem with that?
Okay, but I always respect your decision, and I am just sharing my opinion so that I can give you the best explanation and I can help you more with it.
Okay, proceed.
And may I know that whom do you live with?
I'm living with my lovely wife. She is with me for more than 10 years.
And how is her condition? How is her? Uh,
She is absolutely fine.
that sounds good. And may I know that do you have ever thought of sharing your condition with her?
Why should I? I can take my treatment. I will be fine, and I will continue my life normally without informing her.
Okay. Again, I am telling you that I always respect your decision, but will it be okay if I tell you about the disease condition more?
I know everything about it's HIV, this virus, this bug. But as long as my wife is fine, and I will take all the precaution I will use condom, and I will take all the precaution. She will be fine. I assure you.
Okay, I can understand that, but is it okay if I explain you a little bit more?
Okay. Yes, if I did like what I tell you, is there will be any danger to my wife? She will be safe. I will use condom. I will have all the precaution.
Okay, I can understand that you know a lot about your condition, but I think I need to add something so that you can get a little bit idea and you can again take decision. And I will always respect your decision.
Okay.
And actually, this bug that is we called HAP, it enters body through the blood channel, through the blood, and also through the intimate contact. And again, this bug may remain silent for years, a few years, even more than a decade, that no one will be able to detect that he is carrying this bug. And when this,
So, is there any possibility that my wife also affected?
I am sorry to say that, but it is possible that she is also affected, but it is not totally certain that she is affected, but there is high possibility.
So, do you think it's really important to tell her so she will get treatment?
I think that it will be better to discuss this condition with her, and if you have any issue, then we can uh, discuss this condition with your permission. And if she takes decision to do the test, we can do the test, and after the test comes, we can decide on that basis. I think it will
So,
be the
doctor,
best
please
option.
do for her the test without informing her that I have the disease. I can come with her. You take the blood sample and do the test for her.
Okay. And do you want to disclose this your condition with her?
No, do the test for her without informing.
Okay, I can understand that what is happening through your mind, but we cannot do this test without her consent, and we need to take her consent. And if yeah, during the consent taking or during the talking with her, if she wants that, why we are suspecting doing
Time up,
this,
but proceed.
and if she
Time up, but proceed.
and okay, and if she insists that,
Proceed. Continue.
okay, and continue. And if you come with her and we want to do the test, but before doing this type of test, there are certain type of tests that we need the consent of the person we are doing the test. So if she wants to know that why we are going to do the test, then we have to disclose this condition. I am sorry to tell you that.
Uh, but doctor, I'm afraid. So no way I should inform her, and so she can get treatment. I'm afraid if you inform her, she will leave me.
Okay, I can understand that what is going through your mind, but there are a lot of people who have undergone through this condition, and you can again take decision. We are not telling you that you should do it immediately, but you can take decision, and we have good caring team that they can deliver this condition to their partners in a very professional and gentle way, so that there doesn't have any problem. And if you want me, I can arrange a meeting with them so that you can first talk with them, take their opinion, and after then you can again take decision. Will it be okay with you?
Thank you very much for the nice explanation. Thank you. I love you.
So I'm going to arrange that
Do
discussion.
whatever you want.
Okay. And may I know that do you have any question or any concern?
No more. Thank you.
Okay, thank you. I am going to arrange that discussion with them so that you can get a better idea about it.
Okay, thank you.
Thank you.
So, doctor, do you want to add anything for the discussion?
The time was so limited, so
Yeah.
I couldn't complete the task within the time. I think that was a drawback for me.
Okay, but you explained very nice and very valuable information. What is the legal issue here?
Legal issue is confidentiality. That is, patient have the right to keep his condition confidential. Then the thing is judgment. Patient can accept or reject the proposed treatment. Then
Are you if the patient refuse to inform his wife, are you going to inform?
it is not our duty to inform her partner, but if there is any certain occasion, if their partner ask our hospital, then we can deliver this we can deliver this message to their partner.
In which condition you can breach confidentiality?
Yes, so we can breach confidentiality for the good of the great for the good for the greater. Like if this condition is somewhat contagious, yes, then we can again breach the confidentiality. Like if, infection with salmonella. Then if his job involves any food handling, then we can always disclose this condition to their job provider. Or any patient with tuberculosis, we can breach this confidentiality that it is a contagious condition. And also, if the court or legal authorities ask for any information, then at that time we can breach the confidentiality. And again, if I think that this patient is going to harm to the state or any other person, at that time I can also breach the confidentiality.
Okay, thank you, Doctor. Anything to add, Dr. Binak?
No, I think that was enough. Actually, time was very short. This case,
Yes.
there were, I think, some more questions could have been asked, and he also could have answered some more questions.
Time was limited, so limited.
Very limited, because in station 4 or this type, just to build report, actually 2 or 3 minutes goes away. Okay, just to build that simple report.
Yeah,
It's very difficult to complete in a whole 6 minutes.
but we will have to practice this way.
It's very difficult. It's very difficult.
We are putting under this difficulty.
Mm-hmm. It's okay. Now, what will we do?
Start.
Hello.
Hello.
This is Dr. Gabra, the doctor in the joint clinic today. Are you Mrs. Selena, 35-year-old?
Yes, Doctor, I am.
So we are here today to discuss your condition and what we can do further. Is that okay with you?
Okay, Doctor.
So before we proceed, how are you feeling now?
Doctor, after taking some treatment, I feel that I am good now.
Good to hear that. How much you get about your condition?
Okay, Doctor. Actually, this type of event happened before. This is not a new thing. Just after coming to the hospital, your doctor gave me treatment like before, and this time he ran some new blood test and told me that there might be some other thing along with my previous condition SLE. And that time he sent those tests and also came out with telling me that I have another condition, and he told me that it would be something called antiphospholipid syndrome. He told me that I have this condition, and he also told that yeah, you will discuss this condition in more details with me.
So, Mrs. Selena, as you said correctly, along with your condition of systemic lupus erythematosus, which was discussed with you before, you have a combined condition which called antiphospholipid syndrome. Do you want to know more about it?
Okay, doctor, your doctor gave me some idea about it.
So in this condition, Mrs. Selena, there is increased ability in your body to make clot formation in your body, and you have already multiple episodes of and attack of clot formation in your blood channel, which goes to your lung and cause danger to your lung. For that, the team discussed your condition and they decided to start a treatment for you. Which is a Warfarin. Have you ever heard about the treatment Warfarin?
No, doctor, what is it?
It is a type of treatment. It come with tablet form. You can give take by your own. It is blood thinning medication, which can give thinning to your blood, so it protect your blood from clotting. So you will be at less risk to have clotting formation migrating to your blood channel again.
Okay, doctor.
Is it clear so far?
I really feeling very happy that it has treatment, and actually I support for it. But does it have any side effect?
For sure, for that, I'm coming to tell you that each treatment has its own unwanted effect. This medication, we should take it very carefully and in regular manner and not to miss any doses. and it needs follow-up measurement of its level in the blood. Because if we take the treatment warfarin more than required, it will cause more thinning to our blood, and it cause more bleeding and more hemorrhage, and it may cause bleeding in our stomach or other organ in our body. Am I clear so far?
Yes, doctor, that is horrible for me. And can I die from
So,
taking this medication?
Mrs. Selena, this very difficult
1 minute
question.
remaining.
Any treatment has dangerous effect, but we can reduce this effect by controlling the level in the blood by frequent checking, and we will keep our management in the treatment level, so it will reduce the side effect much, and the chance to die from this medication will be very minimal, but there is chance. So what we need to do now to after we start this medication, we will do frequent check to special test in our blood. It's called INR. It measures the level of thinning the blood in our blood, and it will guide the treatment. So and in the same time, you need I will provide you
Time
with
up.
and leaflet. Sorry because some
Time
food
up.
should be avoided. Thank you.
Okay, so patient have other few concern. You can answer those. Okay, doctor, will it affect my pregnancy?
Mrs. Selena, you need to take now to avoid pregnancy now, and to follow up with your woman doctor. And if you want to plan for pregnancy, you will be follow up by woman doctor and blood, and your doctor will stop this medication, and he will give you another medication which cannot affect the baby, because this medication affects the baby.
That is another issue with me, doctor. And can I take it just like regular medication, or will I need to take any specific advice, specific follow-up?
You need from your food, you should avoid some such type of food. For that, you will be followed up by our dietitian, and will provide you with the list of food and medication you should avoid it. And when you go to doctor, you inform him that you are taking warfarin, so he will prescribe you the good treatment, which cannot interact with this medication.
But is there anything that I can be sure that I have some problem with those medication at home?
Like what? I didn't get you.
Is there any sign that I should be
Sign.
aware of at home?
Yeah, for sure. I will provide you with brochure that if you have any change in the color of the skin, like ecchymosis, bruises, change in the color, any swelling in your joint, any headache, it could be a sign of over treatment in this medication, and you should do a test and go to your doctor to adjust your medication.
Okay, doctor, I can understand. Is there any alternative to it?
This is the best treatment prescribed by your doctor, but there is alternative, but maybe it's less effective, but there is alternative, which is doesn't need follow up by level test, but also it carry the side effect of bleeding and over thinning.
Okay, doctor. Thank you. I will
Thank you.
decide it again.
Thank you very much.
Okay, Pinak, do you want to add anything? point on it?
No, but I think that the pregnancy issue should have been asked at a bit early stage because she's 35 years. So had she had any pregnancy losses? Actually, she told that I have suffered before. I think there were some hints there. I'm not sure whether she had some loss of pregnancy before. I think this could have been asked.
Yes, his performance was excellent. Just one thing that if you could haven't repeat, as I have told you that I have antiphospholipid syndrome, you could have you should have go for the management plan earlier because we have less time, so you could cover all those.
Yeah, it is very limited time.
Yes, for that
It's
Yes,
almost
yes, it is
impossible.
very, very limited
very
time
limited time.
actually.
So for that, I already give you all the clues and all the hints that I know a lot about it. So yeah, if you haven't repeated, you could get a later more time.
So there is some point it's mandatory to cover in the 6 minutes in this scenario. Can you count it for me? So
Okay, actually, you have explained the mechanism. You have explained the proposed management, that is lifelong warfarin, and you have explained that how it works. And after that, in the side effects section, you should have told me that it should be taken at a regular time, and also it can affect the pregnancy, and also it due to over thinning or under thinning. For the under thinning, there are some this condition can happen again with over thinning. There is signs of risk of bleeding from the area. For that, I can give you brochure so that you can get idea that what are the signs of bleeding or overacting and what are the signs of underacting. And as I have asked you that how will I know, you explained it well, but you could have give all the information at a time.
but
Yeah.
I should tell it by myself, not to
Already,
wait for the.
already patient asked that what are the side effects. So at that time, if you gave all the hints, then if asked later, then you could explain it more. In the side effects, you only told about eating, over thinning medication. In that time, you if you gave the hints that it can affect the pregnancy, it can affect the certain medication that certain medication can improve, so that you should have informed your doctor before taking any medication. You cannot take all the medications, and there are certain actions with the food. So we'll recommend a visit to the dietitian so that he can review your food. So you could you could cover everything within this time. Patient already asked that what are the side effects. Okay, your every explanation was fine. Just I think you could have reduced the time just without repeating those, because we haven't time for
We need time management.
yes, for time management is the best management here, I think, because we know all the answers, but time management will kill our performance. Okay, we are going for the next case. Do you want to add anything?
No.
Hello, I am Dr. Bishas. I am a doctor of this clinic.
Okay.
I confirm that you are Mrs. Selena, 35 years.
Yes, I am.
Okay. So may I know that how do you feel now?
Okay, doctor. I'm suffering for a long time for the condition called systemic lupus erythematosus, and I have on top of that the antiphospholipid syndrome, which cause multiple thrombus in my lung, and I start the medication called Warfarin. I started like 3 months ago, but 10 days ago I start having blood coming from my nose, and I am suffering, doctor.
I'm sorry to hear that. And may I know that do you have any idea why the blood is coming through nose?
I never have this issue before, doctor. But after you start me with this medication, I have it all.
Actually, there are a few possibilities for blood coming through the nose, like any injury if you have had into your nose, but like nose breathing, any
No, I never.
okay, and any infection into your nose,
No,
any cold, sneezing,
no.
and also there is possible that the drug itself can cause this type of condition. And before I proceed, may I know that have you told about the toxicity or about the side effects of the warfarin?
The doctor met me that time, but he told me briefly, and I don't concentrate much. I want to start the treatment for my suffering, so I don't care much about the side effect. But now I am suffering really.
Yeah, actually, we are suspecting at this time that you are having this problem due to this overacting of this medication, and we are trying to find out that why this is happening with you.
Okay.
I am sorry for your condition, and for yes, you know that this warfarin tablets thins the blood, and when it excessively thins the blood, then there is possible that with some minute or minor injury the blood can comes out because blood cannot be thick or pull out easily. Do you get me?
Yes.
And for this we have already started the treatment, but I am just discussing this condition with you. And at this time I also need to know something personal from you. Will it be okay?
Okay.
Did you take this medication regularly?
I take it every day, doctor.
Did you take any special or any other medication along with this?
No.
Uh, have you ever taken any dose more than normal?
No, it is the same dose that prescribe. I do
Uh,
it.
when did you last check your INR or maintain your yellow book?
Really, doctor, I want to tell you that it's really difficult for me to do it very frequent. The doctor asked me to do it in weekly basis, but it's really difficult. It costs me much, so I do it when I feel that there is something different in my body. And the level was okay for several weeks, so I skip it.
Yeah, I am sorry for that. And if you don't mind, and we can discuss this issue with our senior, and they will try to find out that what can be done at your situation so that you can get a proper level of monitoring.
Doctor, can I stop this medication? I don't like it anymore.
Okay, I can understand that you are having problem with this. 1 minute remaining, and I will discuss this condition with the joint doctor again, and they will review your medication, and again they will discuss this condition if they want to change the medication or if any other medication that can be alternative to it.
So there is an alternative, and if there is alternative, is it cause the same like bleeding and bleeding of my nose and everything?
Uh, uh,
And
yes, please.
that's all.
And truly speaking, I am not a specialist into this situation. I would discuss this situation with the joint doctor, and they will be able to give you the best explanation. I am sorry to tell you that. Time up.
Okay. Is there any important question in your mind that
Yes, I'd like
should be
to.
asked?
Yes, I'd like to ask any signs of internal bleeding, like any hematemesis, any history of melena, and any history of any headache that is of recent origin, and any weakness at any site, any focal signs of neurological deficiency.
But it will be too much question, and question not really recommended in the communication station.
Yes, but in the session of discussion, I would like to discuss those. That our diagnosis of warfarin toxicity and if it has affected
Uh,
internal organs or not.
So you are answering the examiner.
Yes.
I'm asking you if there is any more question in the communication, not the examiner question.
Yeah, I cannot remember actually.
So, should we ask about the here the diet, to modify the diet?
Okay, certain types of food, that is seeds, I cannot remember much, and iron rich food, they can affect warfarin absorption.
Yeah, almost all herbal food like spinach and spinach.
Okay.
هذا البيبر like food
Okay.
like spinach, some juice, some type of juice, medication like antibiotic.
Yes. That is
Ciprofloxacin,
cytochrome
metformin.
reductase inhibitors medication.
Do you want to add anything for this case?
No, I cannot remember much. Just there was one thing that patient were asking that can I die from this condition? This was a common question for most of the patients.
And what is the proper answer for this? No, it's difficult to predict this one, but it's a possibility.
I can understand that you are really upset about this with this issue, and we have started the treatment already, suspecting that you have this condition, and they are very good medications that will help you, but we cannot exactly say you that uh, this cannot do any further harm. I'm sorry to say that. But this medications that we have started treatment, they are very good medication and they are very effective medication.
It seems Dr. Binak left already.
He left, I think.
Okay, I don't have more question for this.
Okay, then I'm going for the next case. Okay,
Okay.
start.
Hello.
Hello.
This Dr. Gabra, doctor in the medical clinic today. Are you Mrs. Selina, 35-year-old?
Yes, doctor, I am.
Okay, we are here today to discuss your condition and what we can do further. Is that okay with you?
Okay, doctor.
So before we start, can I know how much you know about your condition?
Actually, doctor, this is a totally new thing for me. I haven't this condition before, and yesterday night I started suddenly vomiting, and after the end of my vomiting, I noticed that I am passing some blood, and they were first bright red, and after that. I called the emergency department and I was brought to the emergency department. And at that time, after coming to the hospital, even I passed some black colored clotted blood. Doctor said that I have lost a huge amount of blood, so they gave me 3 units of blood that time, and now I am feeling better.
It's good to know that you are feeling better, and I'm sorry for your suffering. I'll try to help you as much as I can. So, as you said, you have massive bleeding from your gut, and the doctor, your specialist, decided that you need further treatment for that because there is possibility that there is a pathology in your stomach causing this bleeding.
So what
So
are you
far,
going
we
to do
don't
now,
know.
doctor?
Sorry.
What are you going to do now?
In case to know the source of bleeding and to control it, you need a procedure called gastroendoscopy. Have you ever heard about it?
No, doctor. How it is done?
Do you want me to explain it?
Yes, doctor.
It is a camera test that a very small, tiny camera introducing from your mouth to your gut. It reach your stomach. It give clear vision to all your internal organ and your stomach. We can see what's going on there and if there is any clear source of your bleeding, and we can do some procedure to control the bleeding.
That sounds good, doctor. But will I be unconscious during the procedure?
Usually this procedure done under conscious, so you will be fully awake and you can see all the procedure, and you'll feel a little bit uncomfort. But if you feel more uncomfort, we can give some sedative medication that it ease your discomfort. Is that okay with you?
Okay, doctor. And is it painful?
It is, as I told you, it is not painful, but it causes some discomfort, and we can use some analgesia, some pain medication locally, and some sedative can ease your discomfort and pain.
Okay, doctor, that sounds good, and you're going to do it. But does it have any side effect that I should be aware of?
Uh, for, for sure, every procedure, especially if invasive procedure, has its own unwanted effects. Especially in your case, maybe we need to take a piece from your stomach to examine it later. So before the procedure, maybe you'll have some pain, some discomfort. Maybe you'll have maybe one of the side effects: infection, pain, bleeding, rupture of the internal
1 minute remaining.
uh, gut. And during the taken biopsy, maybe you'll have some bleeding, but don't worry about that. This all side effect will be minimal because the best team will handle your procedure. They do it several times with no issue. And after the procedure, we'll keep you admitted to our unit, and we will observe you and observe your vital sign for follow-up. Do you have any more concern, Mrs. Selina?
Doctor, one thing that I am getting worried that you said it can perforate my gut. Uh, is there that I have chance of dying from this procedure?
Mrs. Selina, every procedure have the side effect, but as
I'm
I
off,
told you,
but you can continue.
this side effect very rare and very minimal, as it done under direct vision, and the best team will do it for you. And you will be under follow-up and observation, and will treat you directly if anything unwanted happen.
Okay, doctor. And is there any alternative to it?
I'm sorry, Mrs. Selina, but this is the best treatment for you. We can have direct vision and direct treatment to your source of bleeding. Otherwise, we will treat you blindly, and the effect will not be compared to this procedure.
Doctor, I have heard some type of capsule like camera that can also do this camera. Cannot you do that for me?
There is, as you said correctly, there is a type of camera, but it gives different vision to different place in the gut, and it doesn't provide direct treatment as the camera test do. And the camera test is the best treatment prescribed by your doctor.
Okay, doctor. Is it necessary for me?
It is very important for your treatment, and it guides your treatment, and it provides direct therapy and treatment to your problem.
Okay, doctor. Then I will take my decision again. Can I inform you later?
For sure, you have all the information and take your time to review and write the consent. But I want to tell you that the procedure is very important and it should be as soon as possible. Any delay in the treatment will worsen the outcome. So better to decide very fast.
Okay. Thank you, doctor.
Thank you very much.
Actually, your everything was fine. Just but one thing I cannot remember that. What did you say? Perforation or rupture?
Rupture, I think.
Oh,
Perforation.
perforation is a
I
medical.
don't remember also.
Okay.
Any difference?
Yes, perforation is a medical term.
Rupture. Which one is
Rupture or
rupture
injury?
medical?
Yes, rupture or injury. That is layman term.
What we should say?
Rupture or tearing or injury. You were good. Everything that was fine, and in the
Again, time management problem.
again time management, and in the that is called in the side effects. When I have a side effect, you manage sometime that okay, it has some side effects, but we are doing it with a good caring hand, and they are very good at it, so that there will be a less chance of having this side effects. And side effects include that during the introduction of this camera, there might be some discomfort, there might be some rupture due to this camera or injury to the gut wall. And, there can be some bleeding also, and it can also affect the heart as cardiopulmonary cardiac arrest. As I remember that it is a complication of
I should mention it. I should mention it, right?
You can
Now, sometime very rare.
it can affect. It can also affect the heart. It can affect the heart. Then again, reassure that okay, but we have very good team, and they are is likely to be less chance of having those. First, before saying side effects, just reassure the patient that so that he will not get worried after hearing all those side effects. Okay.
Okay.
So just reassure like this, and again after telling the side effects, reassure him again. So he will get idea that there is less chance, but have side effects. Okay, otherwise everything was fine. I'm going for the next page. Okay.
Okay.
Hello, I am Dr. Bishas. I am a doctor of this clinic. I confirm that you are Mrs. Selena, 35 years.
Correct.
Okay. May I know that how do you feel now?
Doctor, I have that headache and problem in my eye for several days. I went to my GP. He did some imaging and some tests, and I am here today to know about the result.
And do you have any idea about this test results and what we are suspecting?
I don't know.
And your test result, that is imaging of your brain, and the blood test, all that came normal. And for your condition, that headache and so problem in your vision, we are suspecting that you have a condition called idiopathic intracranial hypertension. Have you ever heard of it?
No, I I have some friends have the same condition, but what are you going to do for that?
And to rule out this condition, we need to do a procedure, and that is also going to help you with this condition. That is sometimes it is called also that it can be given as a therapy, and we call it lumbar puncture. Have you ever heard of it?
No, doctor, can you explain more about it?
Okay. Actually, in this with this procedure, we will need to take some fluid from your spine. Do you get me?
It sounds very horrible. How you can do that?
Okay. We will first remain use seated, or you can also lie down, whatever you prefer. And after that, on the back, and you can see that just like before the hip bone, there is a space in our spine. And at this space, around that space, first we are going to wash that area with some agent to kill the bugs. And after that, we are going to give you some numbing agent so that you will not feel pain. But during the giving the numbing agent, you may feel little discomfort, little pain. But after giving the numbing agent, it's likely that you will not feel any pain. Do you get me?
Sounds stressful. How you can do? Is there any problem with that? Am I going to die from this procedure?
Okay. And before I give you answer, can I describe it more little?
Okay, proceed.
Okay. And after giving the numbing agent, we will introduce a needle into your spine. And with that needle, we will collect some fluid from your spine. Okay.
Okay.
And actually, at this level where we introduce the needle, there is no nerve that can damage you. And also, we will bring the fluid in a little amount, so it will less likely affect your brain. And also, your brain imaging was normal, so there is very less likely chance that it will affect brain, or it will also affect any other condition. And uh, I cannot guarantee, but there is very little chance of dying from this condition, because and also we are going with expert hand, and we have done all the tests before doing this, so that it will be very less likely. Do you get me?
I get you, but it really sounds very stressful. Uh, should I have any problem after this procedure?
Yep, and like all this procedure, it has some side effects, but the side effects will be minimized by your expert hand, and they are very good at it. The side effects include that you can develop some headache due to release of pressure, but the chance is very less. And during giving the introducing the needle, there might be some infection in the brain, infection in the skin. There might be some pain. There might be some injury to the spine, but they are very less likely because we have expert hand. There might be some bleeding also, but all this side effects will be very minimal because we have expert hand, and we will always monitor you even after performing the test.
And can I go home after this procedure?
Yeah, after this procedure, it is a day basis to care. We will first monitor you for a few time, and after that you can go home.
Doctor, if I don't want to do this procedure, is there any alternative?
Actually, this is also act as a treatment and also confirm the diagnosis. We have some other options that we can go for it, just like giving you some medication and waiting for the time off. Should I proceed?
I think no. I think everything go fine, and I think no more detail to be explained, right?
Yeah, actually, this is a procedure. There are some other medications that can lower the pressure in the brain, but for that we have to wait and see, and we are going to do that blindly. And this is the best option along with your condition. And if you want to know more, I can share you some leaflets, some video links so that you can get a better idea about that. And you can also discuss this condition in more details with us after giving an idea about it.
Okay, thank you, doctor. Thank you.
Thank you.
Any more point need to be explained?
I cannot remember much actually.
Okay, fine. If patient signed the consent and before the procedure decided to cancel it, do you allow?
Yes, patient has always all the right to take decision and refuse the decision. Just he cannot propose any management.
If you do the lumbar puncture and you have damage of the and you have weakness in the lower limb, what do you consider this error or side effect?
Okay, actually, lumbar puncture is done at the stage where and far below the end of the spinal cord, so there will be very less likely chance. And if that type of problem arises, that can be due to very inappropriate management of the needle, or that can also be due to the any other pathologies that have present.
So it is complication, not error, right? Error that medical mistake lead to patient harm,
Yes,
but this consider as complication of the procedure.
yes, these are the complications, not the medical error.
Mm, that's all.
Okay, then I am going for the next case. Okay, start.
Hello,
Hello.
this Dr. Gabra, the doctor in the General Medical Clinic. Are you Mrs. Serena, 35-year-old?
Yes, doctor, I am.
Well, we are here today to discuss your condition and what we can do further. Is that okay with you?
Okay, doctor.
So before we proceed, how much you know about your condition?
Doctor, I had a shortness of breath for a quite a long time. That's about for 1 year. And this time I also developed some swelling in my legs. And shortness of breath was severe. And after that, I came to the hospital. They gave me some medication. With that, I am feeling good. But they also did some ECG and some other imaging test of my heart. And they said that the condition isn't good and I have pressure in my heart. And also they say that they will go for the other test if they find.
Mhm. Okay, Mrs. Selena, as you said, and based on your examination and your blood test and your imaging, your team suspected a condition called primary pulmonary hypertension. And for that, your team decided that the best for you to do a procedure called cardiac catheterization. Have you ever heard about it?
No, doctor, what is it?
So, Mrs. Selina, it is a procedure in which there will be a dye or contrast. At first, there will be guidance will proceed into your blood channel from your thigh, the medium vein in your thigh, and proceed to your blood channel in the heart, and there will be some dye or contrast inject in your blood channel, and there will be a camera so we can see all blood channel inside your heart. Is that clear so far?
Okay, doctor, that you said that you're going to introduce a wear.
Yes.
So, is it painful procedure?
Mrs. Selina, I appreciate your concern. There will be a pre-procedure. There will be a cleaning to the area in your thigh. The doctor who performs this procedure, who expert in this procedure, will numb the skin in the area where he will introduce. There will be small cut. A wire will be introduced. You will have some numbness or some pain or discomfort, but it will be minimal as the team will take care in this time. And the team will monitor you along the procedure. There will be some complication, but it will be minimal as the best team will do the procedure who do it several times with minimal complication. This complication include injury in the area of injection, injury of the blood channel, some bleeding, infection, uh, pacing and bracing of your heart, and in rare condition, maybe you will have heart attack or heart arrest. But don't worry about that. The best team will do this, who do it many times, and you will be under observation all the time, and will be treated right away. How does this sound for you?
Okay, doctor, that is somewhat scary for me. Will I be conscious during the procedure?
Yes, you will be totally conscious, but that you will be totally conscious, but and the team will give you some numbness item to your skin, so you will not feel any pain. Maybe you will feel a little discomfort only.
Okay, doctor, and it is somewhat scary though. But is it necessary? Don't have you any other alternative?
Mrs. Selena, this is the best treatment for you in this time. It guide the future plan, and so we can give you the best treatment. We will know what you have exactly and how we treat it. Otherwise, we'll treat you blindly, and maybe you will have an unwanted effect from blind treatment.
Time off.
Okay, thank you, Mrs. Selena.
Thank you. So, is it a operation? Is it like a operation, doctor?
It is not operation, but it is minimal procedure. It done in the special theater with the maximum hygiene, and there is special team will do it for you.
Okay, that sounds good. And can I go home after the procedure?
Mrs. Selena, I appreciate your concern. You will need observation for some time, and after the team make sure that you are ready to go home, you will go home with several hours.
Okay, doctor, that sounds good. Thank you.
Thank you.
Yeah, you covered everything within the time. That was fine. You haven't repeated most of the cases that gave you time actually. Cardiac catheter.
Really, it's difficult to cover everything in short time.
Yeah, that's why try to give maximum information, but with proper pausing, because just giving the information will not bring the mark. You should give
The problem
proper.
is my language doesn't help. I have multiple pause and multiple interruption. My brain doing the search for word to,
Okay,
to say it.
this happens for the first time. In the past, when I practice first, I just I we whose English is the second language. We have to find words. We have to translate. After that, we have to deliver the answer. So it will consume time, but with practice, it will be okay. And there will be some grammatical mistakes, and I still now do that, but that is not a huge problem for the exam. It is not a linguistic exam, so it will not make anything bad, but with proper practice you will be more fluent.
They consider communication.
Hello, I am Dr. Bishas. I am a doctor of this clinic. I confirm that you are Mrs. Selena, 35 years.
Yes, I am.
How do you feel now?
Yes, doctor. I have some cough and shortness of breath. I come to the doctor, and he do some imaging and the blood tests, and I am here today to see the result.
Okay, and I am sorry that you have suffered for this. And do you have any idea what could be the result?
At the beginning, I thought that it is some bug infection, but I get scary that there is something wrong going with me. Is there anything?
Okay, actually, we are not quite sure exactly what is happening with you. And on your chest imaging, that is X-ray, that shows that there is some a mark, scar mark in your lung, and
Shadow.
we are not sure. Yes, a shadow in your lung, and we are not sure that what is it.
What is it, doctor? Is it a cancer?
Yeah, and I cannot tell you exactly that what is it. It can be a cancer, or it can be a bug infection. Sometimes it can be a totally normal thing. Sometimes it can be some salt deposition, or also it can be some we call harmless growth. But we have to do a special test called bronchoscopy to rule out what is this. Do you get me?
So what are you going to do?
We want to do a special camera test called bronchoscopy. With that, we will see the lesion that you have, and we may take some tissue from that for a study to rule out that what is to establish that what is this.
It sounds scary for me. How is this done? Can you explain more?
Okay, that we will do a camera test. That is, we will pass a tube through your mouth and up to the lung where is the shadow present. And in that time, you may feel little discomfort with this, but we will take care of that. We will give you some medication so that you feel less discomfort. Do
So
you,
I'll be sleeping that time, or I'll be conscious.
okay, actually, you will feel little bit sleepy, but you will remain conscious.
So is it an operation under anesthesia?
No, it is not just like operation, but with this, we will just introduce a camera to the lung, and we can take a small cut of your lung to study. It is not
And anything dangerous can be happen during that time.
yeah, I can understand your concern. There are certain possibilities that can happen, but we have very expert team. So possibilities of having this dangerous things is very less. And these things include just when giving the introducing the camera, you can feel some pain. And after introducing the camera, there can be some rupture or injury to the lung. There can be some bleeding, and there can be some bug infection after the procedure. But we have very good team, and having those things, chance of having those things is very less.
So could I die from this procedure?
Yeah, actually, I am not hiding anything from you, but there is very low chance of dying from this condition, just like excessive bleeding or very large injury to the lung or injury to the, even to the heart that can also uh, cause a serious
And,
condition. But having this,
doctor, you can do scan, you can do anything. Why to do this invasive?
okay, actually we have other alternatives like other type of scanning, but our consultant senior doctor found out that this will be the best option to study about the shadow that present in your lung, and this would be the best option. So he went for that. Even we do the scanning, we may also go for the we may also need to for the this type of test again.
So, so should if I don't want to do this, what will happen?
Uh, Actually, we always respect your decision. And again, if you need any other help, I can give you some leaflets. I can give you some time up.
Okay, thank you.
Thank you.
So, in many scenario, I noticed that you don't set agenda for the communication. I think it's required, right? You should explain to the patient why you are here and what we are going to do. Is that correct?
Yes.
There is special mark for the agenda, right?
Yes. Yes. I always forgot that.
Mm,
I should have explained that. What is what it would be our discussion? What why we are here today? I should have always mentioned it, but I always forgot.
Otherwise, you explain nicely all the points.
Again, time management was a difficult thing for me.
Yeah, but we should know in the Irish what is the marking sheet.
I
Maybe not require the agenda. My agenda.
Yeah, I went for the mark sheet, but it isn't explained. Okay, start.
Hello.
Hello.
This is Dr. Gabra, the doctor in the General Medical Clinic. Are you Mrs. Selena, 35-year-old?
Yes, doctor.
So we are here today to discuss your condition and what we can do further. Is that okay with you?
Okay, doctor.
So before we proceed, can you tell me what do you know about your condition?
Doctor, for the last 6 months, I had diarrhea and quite a few times a day. I had to pass my bowel about 4 to 6 times a day, and sometimes I pass blood into it. And for the time being, I have also lost a few kg weight. For that, I visited my GP, but my condition wasn't improving. Then he sent me here, and after coming here, they made some blood test, and they said that there are something abnormal. So they will go for the next level of management, and I don't know that what kind of management I need further.
Miss Selena, I'm sorry about all your suffering and we will try our best to help you about that. So, Mrs. Selena, I'm here today to explain for you the further management for your condition. and your team, and after reviewing your medication, your condition, and blood test and imaging, they decide to you a colonoscopy. Have you ever heard about it?
No, doctor. What is this?
So, Mrs. Selena, the colonoscopy is a type of procedure in which there is a small camera. There is specialist who will do this procedure, who did this procedure many times. He will prepare you first, then small camera uh, carried by special tube. It will be introduced in your lower gut, and it will introduce in your large bowel to see from inside. The camera will show clearly the internal organ in your large bowel, and will find uh, how extend your disease is and how severe is. And sometime we need to take a small piece from your bowel to study it further. Is that clear so far?
Sure, okay, doctor. This is something scary for me that you are going to introduce a camera through my back passes. Isn't it right?
Yes, right. But don't worry about that, Miss Selena. I appreciate your worry, but the best team will do this, and we will do it with minimal complication. There will be a monitor all over the procedure
Okay, doctor. And
uh,
is it
to
painful?
minimize. It is not painful, but it causes some discomfort, and we'll try our best to minimize the discomfort for you.
Doctor. And is there any side effect? You said that it is necessary. I understand it is necessary, but is there any side effect that I should be aware of?
Mrs. Selena, I appreciate your concern. All procedure has its own side effect, but it will be minimal with the best hand. Best team will carry your procedure, and they do it many times with less side effect. The side effects include some pain, discomfort while introducing the camera. Maybe there is injury, bleeding, infection, injury to the internal organ. But be sure we will do it very carefully with minimal interaction.
Doctor, I
And,
can understand. And
any more concern?
is there any chance of dying? There is
Don't
chance of
worry, Mrs. Selena.
in
I don't want to.
1 minute remaining.
Uh, I'm not hiding anything from you. Any procedure carry a risk. There is very rare chance from dying, but it's very rare to happen. You will be monitor all the procedure, and it will be minimal. And we will monitor you before, during, and after the procedure. And if you have any sort of pain, any tummy pain, any sort of change in the bowel motion after the procedure, please inform us, and we will carry on. Any more concern you have, Ms.
Do you not have any alternative without this test?
Mrs. Selena, this is the best way to know your disease and to take a sample from your large bowel to study it further. It will guide the
Time up.
treatment to give it. Thanks.
Okay, so what
To
are the
give you.
alternatives do you have for this?
Sorry.
What are the alternatives do you have for this procedure?
Alternative. There is no equivalent alternative, but we can do the scanning.
Okay. You have explained everything well, and within a good time, just one thing that you talked about 1.5 minute when was explaining the procedure. Just that was fine. There was no problem. Just after talking after a few seconds, just like half a minute or after 40 seconds, just ensure that patient is getting you. So do you get me now?
Yes.
Have you got this up to this after that? Because whenever you continue talking, it seems that you are not attending to the
Listen,
patient.
no, taking care of.
Yes. Otherwise, everything was fine. You could have explained everything well, and also could give explanation of everything in a totally fine way. That was excellent.
Thank you.